The Indian Medical Association of Queensland has been running a public health lecture series since March 2020. Our members, who are doctors of Indian origin and practice in this wonderful state of Queensland, they volunteered their valuable time and expertise in this endeavour. The advice given by any doctor is of general nature and meant for information and education only. Please note, this is no substitute for your own healthcare professional, and everyone is advised to consult with their own treating physician for ongoing health issues. I will now ask the Secretary-General of IMAQ Queensland, Dr. Cyril Fernandez, to introduce to you our guest speaker of this month.
Welcome to another episode of Aapki Sehat program, meaning your health. It's conducted by the doctors of Indian Medical Association of Queensland. Today we have the pleasure of having Dr. Akshay Mishra, an eminent leading cardiologist in Brisbane. Welcome, Dr. Akshay Mishra.
Abba, thanks. Cyril, thanks for having me on the show.
Welcome, Akshay Mishra, eminent cardiologist, interventional cardiologist. So let me ask you a simple question, Akshay. Can you give us, viewers, an input of your journey as a doctor starting from India and whichever parts of the world, Australia, your professional experiences, etc., etc.?
So that's actually a long answer, sir, but I'll try and make it brief. I'm an army kid, like you're aware, and I think you also have some army background or Air Force background. And I studied wherever my dad got transferred, and I changed 7 schools while growing up. Some people would think it's disruptive. I think it just adds to build up to your personality. So I may have studied in the best schools in India, including La Martiniere Boys and St. John's in Chandigarh, but also studied in Lungting Zampa Primary School, which is a far-off school in Bhutan. I did my medicine from Armed Forces Medical College, and it's a very, very well-known college from India. And when I finished, I had the choice to either join the army or like many of my friends, leave and join Civvy Street. I think I made the right choice. In following the footsteps of my father and my uncle, I did join the army. I did my internship from MH Agra, Military Hospital Agra. And after that, we have to do 4 years in the field. So for my first tenure, I opted for Ladakh Scouts, which is the same battalion my father did his RMO training in. And I was posted to Siachen. I spent 4 months at a height of 18,000 feet. When I finished that, I opted to join the paras, and I was with the paratroopers for a couple of years before coming back to do my specialization in MD medicine. I worked as a what you call a medical specialist in the army for 3 years, and then I left after finishing 10 years in the army. Came to Australia initially, to Canberra, where my wife Bhumika was, and although I was a medical specialist and all, the first role I got here was as a resident, but within the year, I mean, especially with the training which is given back home, I could finish all my exams, and I was already applying for my cardiology training. So cardiology I did at the Gold Coast Hospital and at Prince Charles in Brisbane, and after finishing that, I applied for my fellowship. I went to Chicago, University of Chicago, and from there on to Lenox Hill in New York, where I trained in coronary interventions and peripheral and carotid interventions. Finishing that, we moved back to Brisbane. We went to Canberra first and then moved back to Brisbane. All the moves and all didn't affect me in the least because I had a background of doing that. But after we came back to Brisbane in 2011, my wife Bhumika, who's just been to 2 or 3 places before we got married, she said that any more moves, I have to do it alone. So we decided to stay here, and it's been a good place for us. I have always worked 0.5 or half-time in public, and that's at Prince Charles Hospital. Prince Charles, is probably the best cardiothoracic center in Australia, yes, and it's probably regarded as one of the top 50 in the world. And it's been really, really good working there and having the exposure to the newest procedures, the most complex cases. That's been good. In addition, I have set my own practice up, and I work at the St. Vincent's with a group of cardiologists. It's a very collegial atmosphere. We share on call, and between public and private, I'm quite busy but I enjoy my role, which makes it all worth it.
That sounds good. When you said about the army and stuff, I remember seeing you in the ANZAC parade here, and also in other community, events.
Being having such an army background, I'm very proud of it, like you know. I'm third generation. My grandfather in the army, my dad, and then my brother's still in the army. He's an ophthalmologist, but still serving. It really adds to the personality of a person growing up, and I'm proud to represent India and walk on the ANZAC parade here. We have a group of APMCites who catch up every now and then, and that's fun too. All the veteran patients whom I see here, they have this bonding immediately when they see me because they know I've served there. So I'm able to interact with them at a very different level.
Yep. You see, Akshay, cardiology is a big branch. It's important, for everyone. Heart means heart health. Can you tell us something about like what you do as an interventional cardiologist? What kind of procedures and things for our viewers' interest?
So predominantly I'm a coronary interventionalist. So all the MIs or people who had heart attacks, they get picked up by the hospital or the ambulance or come straight to emergency. And there's one of us, 6 or 7 doctors, who's on call in rotation. And whatever time of the day or night it is, we'll get called in. And we'll do what's called primary PCI, or trying to open the coronary artery, which is 100% blocked, as early as possible. So it does give you an adrenaline rush. With the years going on, it is getting more and more difficult to come and do these calls in the middle of the night. But I think that's part of why we signed up for this role. So I do coronary interventions. In addition to that, I have been trained in peripherals. So I do lower limbs and renal stenting. I treat patients with refractory hypertension by doing a procedure called renal denervation. I'm trained in TAVI procedures. So for people who've got aortic stenosis, no longer they have to go for open heart surgery. For the right population of patients, we can implant a new heart through the groin or the subclavian axis. And it's really revolutionary how cardiology has evolved to make it more and more simple for patients with the worst of conditions, and now they can walk out of hospital in 1 or 2 days being fully treated for whatever problem they come with.
Like minimal invasive compared to big surgeries in the past.
That's right. We live in a place where, and live in an era where cardiology is very, very advanced. It's all guideline driven. So there are lots of major trials which have shown superiority of one technique over the other. So we do what was the best for our patients. A lot of the complex patients being in Brisbane at Prince Charles and St. Vincent's, we can discuss the patients in a heart valve team or a heart team meeting where surgeons, geriatricians, physiotherapists, and all combine, and we decide whether this 92-year-old patient is suitable for having a procedure like having the valve replaced. And a lot of the social aspects come into it, and we look at also the financial aspect of it, whether the patient is actually going to live for the next 2 or 3 years, and whether we should invest as much effort, time, and finances into treating them. And here the longevity of patients is a lot. Many of them are still driving at the age of 90 years, so they do pretty well. And once they have been treated for the primary problem, you'll find that they're very active members of the community rather than being resigned to a nursing home kind of existence, which is pretty terrible.
That sounds like a good team effort with a cardiologist like you, Akshay, in the lead role, and improving the quality of life of people even in advanced age. Now I think Prasima Abba would like to ask something different.
Most specialists have a special interest, and you've talked about interventional cardiology and the newer techniques. Can we assume that's your special interest, or do you have something else you want to further pursue?
Unfortunately, Abba, the way cardiology has evolved, that you've got electrophysiologists, you've got heart failure and transplant physicians, you've got people who deal in the hypertension space, and then you've got interventionalists. I think coronary and peripheral intervention is my passion, and being able to implant cardiac valves is something which I really enjoy. We've got a very sound team where the patients come through, they get assessed over a period of 3 to 4 days, and then if they are deemed suitable after presentation to the heart valve team, that's where we'll just slot them in and do the procedure on there. So I have kind of cut down my practice to address these three, four aspects. Dealing with general patients, atrial fibrillation, all. I mean, I still do and I enjoy. But if I was given a choice, I like to stick to this.
And it does make a big difference in terms of the turnaround time, the recovery time for the patient.
Absolutely.
And the burden of care for the community, for the family members,
True.
for other health professionals as well.
No, absolutely. So it's being recognized more and more that if you can get patients out of hospital in a day or two, rather than them staying in ICU where they're prone for infections, lung collapses, and they just recover much slower. And then in the community, they may be undergoing rehabilitation for a couple of weeks, and then they go home and they can't go back to their jobs or whatever they're doing for a long time. So most patients above the age of 75 at this stage, we would say that they should have an aortic valve replaced via the transcutaneous route rather than having open heart surgery. And we work with surgeons who've come to the party and they also realize that it's the right way to do things. Fortunately, everyone's busy, so there's no real territorial fields here where people are trying to do more and more, because we all have enough work to do. We can just do the best for the patient in the right scenario.
Sounds good.
Seems like you're very, very busy. If you have much time for yourself, what sort of hobbies do you pursue? What do you like doing? What sort of activities do you like doing outside work?
So, see, the reason I joined AFMC is that AFMC was the winner of quiz time, a couple of years before I joined. So my friend and I, we both said we'll join up the college and we'll represent AFMC in quizzing, which we did.
Yes.
So I got college blues for quizzing. I read as when I can. I lose money in stocks, like all of us. I play golf and I play tennis with the kids and all. So socialize, have a good bunch of friends. 24 hours is too less in a day,
Yes.
but we just try to make the most of it.
That's lovely. If there was one health message for our viewers, what would you give?
So a very positive mental attitude is important. Stay optimistic, move, try and be as mobile, get your 10,000 steps or 30 minutes of cardio exercise 4 to 5 times a week. Measure the calories you consume, measure the steps you do. Meals are very important, so see the portion size, see the quality of food. Low calorie foods and less refined foods would be, less processed foods would be the way to go. Low salt in the diet, low sugar is the way to go. I think most people now quite health conscious, and when I speak to the patients, they're already doing a lot of these things. So it's quite easy to get the right practice on board, and that's how they benefit most.
That's a good take-home message for healthy lifestyle strategy, is it not, Abba?
Very much so. It has been an excellent talk, very informative indeed. Thank you so much, Dr. Akshay Mishra, for coming on our program.
Thanks, Abba. Thanks for having me, Cyril.
On behalf of the Doctors of the Indian Medical Association of Queensland, we thank you so much, Dr. Akshay Mishra, eminent cardiologist. Thank you.
Thank you. Thanks so much.